To health news now. More than 1 million people in the United States depend on pacemakers to keep their hearts beating properly.
And up until last week, they weren't allowed to get a key diagnostic test, an MRI. But as News 8 medical reporter Jocelyn Menta tells us, a new type of pacemaker is now making that possible.
I'm at St. Francis Hospital, where earlier this week it was the first hospital in Connecticut to implant an MRI-compatible pacemaker recently approved by the FDA.
This revolutionary pacemaker is key to improving the overall health care for thousands of patients. The Food and Drug Administration approved this MRI-safe pacemaker just 2 weeks ago. Before this new design, MRI imaging was not a viable option for patients with pacemakers.
To obtain images, we would have to do other things like ultrasounds or CAT scans. But there are some areas of the body for which an MRI scan really is the best way to get the best quality images so that we can treat people the best way.
Dr. Neil Lipman, an electrophysiologist at St. Francis Hospital in Hartford, is the first in the state to implant the device after FDA approval.
So it's a three-component system, a new battery and electronics, new wires that connect it to the heart, and a new programming mode to make it safe during the scanning.
His patient, a woman diagnosed with breast cancer in the same side as her existing pacemaker. Dr. Lipman replaced it with this latest device.
Because of the desire to be able to follow up with MRI scans, both in terms of her breasts and also in terms of imaging in other parts of her body where she may develop other disease in the future, we were able to give her an MRI-compatible pacemaker.
So now, for the first time, her doctors can use MRI imaging to follow up and manage her cancer. Each year in the U.S.,
prior to this breakthrough system, about 200,000 pacemaker patients had to forego an MRI scan, critical to a number of diagnoses. On the scene at St. Francis Hospital, Jocelyn Menta, News 8.